So we're looking at a huge double whammy. Our mental health is dropping and our healthcare system is buckling.
But is this just a feeling or is it real? Well, a major global report has some pretty clear answers.
This Mental State of the World report really lays out what's happening post-pandemic. Let's look at the data.
The report uses something called the MHQ. Think of it like a score for how well you're handling life's challenges.
And the global average? Just 63. That's basically just managing, not thriving by any stretch of the imagination.
But here's the kicker. That average score is hiding a huge divide between different age groups. And you can see that gap right here. On the left, that's young adults. On the right, people over 55. I mean, look at these numbers. The average score for young adults is a full 60 points lower. That's staggering.
Okay, so with so many people struggling, who's supposed to help them? That's the other side of this crisis.
Well, the CDC found that the very people we count on, our health workers, are struggling with their own mental health.
Things like trust and having enough time are crucial, but when that's not there, you get massive burnout.
And that pressure is even higher for nurses who are caring for the most vulnerable people in our society.
For example, in prisons, more than half of all inmates have a mental health disorder. Imagine that workload.
But even with all that, they're driven by this incredible desire to help and make a real difference.
So, you've got patients in crisis and providers under strain. How is healthcare even keeping up?
For starters, telehealth has been a total game changer. It's knocking down old barriers like stigma and travel.
We're also seeing a rise in specialized roles, like psychiatric mental health nurse practitioners, or PMHNPs.
And what's amazing is that PMHNPs are bringing care to the most underserved communities out there.
And it's not just new roles. New tech is showing up too, like AI chatbots. Let's talk about them.
AI offers incredible access 24/7, but it also raises a huge question. Can a machine actually show empathy?
So that's the dual crisis. More people need help, and the caregivers themselves are totally burnt out.
But we are seeing innovation. From telehealth and new tech to these amazing specialized nurses, there is a path forward.
So the big question is, will all this be enough? Can these changes really solve our global mental health crisis?